Hello, I'm Dr. Harish Teneti, oral and maxillofacial surgeon, life coach, and Ved Path instructor. Um, I am so for these recently. I'm seeing this surge of increased case of temporomandibular joint or this joint pains. There's so many young girls aged 18, 17, 18 to 25, 30 years age ladies frequently complaining of this joint pains. So I thought I should make a quick video on suppose you have pain here in this region. uh, if it is just a clicking sound when you're opening and just there's a click, don't worry much. That's not going to cause you any trouble. But if there is pain in this region and you are unable to open mouth slowly, suppose you are opening that big and slowly your mouth is getting restricted, I'm sure you should be really worried about it. Okay, your mouth should never get restricted by any chance. Suppose you are getting restricted, suppose you are having any pain in this region, then I want you to meet an oral and maxillofacial surgeon for it. And the one main important aspect I want quickly to help you, guide you, or to understand your condition is this region, the TMJ or temporomandibular joint, is a complex joint. It's diarthroidal joint because two sides are there, and it is having joint and the disc inside, and it's a beautiful joint. It really repairs itself so well. It really adapts to a lot of stresses what we give. But at the same time, suppose you have a lot of pain and tenderness here, I want you to meet a maxillofacial surgeon. One. Second is, in case you are unable to meet a doctor, so what you can quickly do is change yourself into a softer diet. By if you're biting hard on something, stop for at least 15 days, be on soft diet. And you can apply hot and cold packs alternatively, preferably warm packs, very very helpful. And you can apply slight menthol kind of thing, and then you can apply it. The most important aspect of all this is, it is not just the joint, it is a teeth complex, it's a bony complex, and the muscular complex. There are muscles involved, there is bone that is involved, and there are teeth that are involved. If these three are misaligned by some chance, if it can be only teeth, only joint, only bone, only muscle, anything can lead to temporomandibular joint problem. So these three complexes should be always balanced. Suppose you have a bad bite, suppose your jaw is forward placed like this, suppose your jaw is retruded, suppose you have some heavy teeth work done, caps are not properly placed, your teeth are aligned, but upper is metal, lower is zirconium crowns. These days people just go for zirconium crowns are really harsh on joints. If they are very hard and they are not properly aligned, or if they are not sitting properly, if they are not occluding properly, then that can lead to a lot of temporomandibular joint problems. So this thing I want you to keep in mind. Suppose you have this joint pain and recently you had an episode of injury, either by lot of dental work or lot of trauma, that is you're biting your teeth hard, clenching your teeth, and stressful situations, then I want you to really be concerned about it, and you have to go to maxillofacial surgeon. And that too, as I mentioned, 18 to 25, 30 years girls who are getting the temporomandibular joint, that's mainly because of your stress. I want you to control your stress a lot. Sleep disorders these days, because of lack of sleep, maybe because of phones, maybe because of constantly putting your neck down and watching that. Maybe that is one of the reasons for your misalignment of this complex, the neck muscles and the joint, and then you are constantly having a lot of load that may giving you bad night sleeps, and those bad night sleeps are in turn affecting your temporomandibular joints, stiffness in the muscles. And because of stiffness in the muscles, there is an injury to that the disc which is there in between, it is not properly moved by the muscles, and that will lead to temporomandibular joint disorder. It's a complex thing. It is not a single point or one point reason. It is always multifactorial: temporomandibular joint or myofascial pain dysfunction syndrome, or some kind of internal derangement of the joints. They are all complex things. They are multifactorial in origin. There is no single origin, and no one can actually diagnose it until you complain, because most of them are asymptomatic. Until you complain, there'll be a lot of damage in the TMJ. So in case you find some problem with this joint, go immediately. There is a theory which says the number of years you neglect the joint health, so many years it will take to recover. Suppose you left it for 5 years, it will really take 5 years to recover once you realize it. So very very important that these things should not be neglected. The temporomandibular joint health, TMJ health, very very important. So in case you have any of these complaints, you feel free to message me, drharish harish tennet at 1080 at gmail.com. I'll be very very happy to answer you. And in case you haven't found time to see my email me, you can see my Instagram page, Harish Teneti. You can follow me there, or you can follow me at RJHRRY Harry in Insta and Facebook. All right, hope this gave you some insight, and I'll see you in the next video. Until then, please take care, relax, breathe, and let go of all the stress. Your joints will be much much better. Thank you so much.